Oh well, today we're actually talking about boron, one of my favourite minerals. So we'll just go through and check out a few studies and stuff like that, and look at what they actually say, what they cover. They're pretty much reviews. I'm not this is a non-sciencey version. It'll just look at some of the key aspects and what it's useful for. So just to be able to help anybody with strategizing dosages and stuff like that, and food types. So let's get on with it. Well, looking at actually this abstraction, this is just basically a sort of a review to give a general outline. So the actual trace mineral boron is a micronutrient with diverse and vital important roles in metabolism that renders it necessary for plants, animals and human health. As a recent research suggests, possibly for the evolution of life on Earth. As the current article shows, boron has been proven to be an important trace mineral because it, 1, is essential for the growth and maintenance of bones, 2, greatly improves wound healing, 3, beneficially impacts the body's use of estrogen, testosterone and vitamin D, 4, boosts magnesium absorption, 5, reduces levels of inflammation biomarkers such as high sensitivity C-reactive protein and tumor necrosis factor A. 6, it raises levels of antioxidant enzymes such as superoxide dismutase, catalase and glutathione peroxidase. 7, protects against pesticide-induced oxidative stress, heavy metal toxicity. 8, improves the brain's electrical activity, cognitive performance and short-term memory for elders. 9, influences the formation activity of key biomolecules such as S-adenosine methionine, SAMe, which is part of the methylation process. If you need to, I did a thing with Bart on that, so you can check that out. And nicotinamide adenosine dinucleotide, NAD+, as you guys are aware, is part of that supporting the redox potential. Has demonstrated preventative and therapeutic effects in a number of cancers such as prostate, cervical and lung cancers, and multiple and non-Hodgkin's lymphoma. And 11, has helped ameliorate adverse effects of traditional chemotherapeutic agents. In none of the numerous studies conducted to date, however, do boron beneficial effects appear to at intakes pretty much greater than 3 milligrams. No estimated average requirements, so we don't have RDAs for it because basically we just don't have the research, so we've got studies that actually show that it does work for a number of things, but we have not worked out sort of dietary reference intakes in any way, but they have been set at an upper intake level of 20 milligrams per day for individuals aged greater than 18 years of age. So in this regard, we're still basically trying to work out which is the best way to go about it. Certain types of issues in that regard. So it's still early days. We're still trying to get some of these figures worked out, and it will take some time before we really are certain about which way is best to go and all that. So I'll just grab the use upper limits. And just bear with me for a sec. Okay. So basically these are the sort of levels we're looking at. So age, daily upper limits dose. So for children up to the age of 3 milligrams, no more than that. That's the maximum upper limit. So obviously, you know, you'd be looking at breast milk and stuff like that to basically provide those sort of things at that age. Then basically slightly older, it's up to upper limit of 6, so you would stick to about, you know, pretty much getting it from meat and organ meats and stuff like that in small amounts for kids in that regard. Obviously there are most higher sources are in certain carbohydrates like raisins. Dried raisins are really concentrated, very high in that, up to 4 milligrams. So they're a bit on the higher side. So it's you got to be careful with those. And at the same time, it's very high in fructose and stuff like that. So that there are other plants that do have it, but it is chelated, so it's not as bioavailable. Where in fruits, which are much, especially apricots, and it is far more bioavailable in that regard, as long as you have sufficient fat as well to basically access those. But at the same time, they do have other deleterious effects, so it's best to try and get it from animal products, much safer in that regard. Yes, it is lower, and if you're when it comes to carbohydrate metabolism, it tends to use much more boron. It's the reason why, you know, like vitamin C is required at higher doses with carbohydrates, and usually vitamin C comes with those carbohydrates as well. So when we're looking at boron in therapeutic doses, we're looking for dealing with specific problems. When you don't have those problems, you should be getting the level that you're required from animal products and no more. But when we're looking at therapeutic protocols, which I'll discuss at the end, then we basically need to look at, you know, not going over the upper limits, but at the same time, you know, focusing on things that, you know, and that other part there is a bit, you know, the age 14 to 18 is 17. Okay, it's not 1817, it's 17. Okay, so I just forgot to put a space in there. A bit poor on my side, but yes, so just keep that in mind. Now we'll just get rid of that. I'll just cover a few points here. It does help boost magnesium absorption, which is really important, which is really good. It's been shown to basically the benefit here is also normalizing estrogen, and a lot of women who are postmenopausal do find that taking boron through that period of transition can sort of normalize their estrogen levels and adapt them. I mean, males still need estrogen as well. We still need some. We don't need a lot, but we still need some level of estrogen for the purposes of basically like that. We just don't need the massive amounts that women need, which is much higher. But as I've pointed out, we produce normally about 53,000 nanograms. So, you know, we produce quite a bit. Women far more, 630 odd thousand. So in nanograms. So basically what this does is sort of normalize and adjust into the proper physiological bands for both men and women, their estrogens and their testosterone. So it balances those much better. Men tend to have more estrogen issues, so it balances estrogen and testosterone, and women the other way round. So it's really important in that regard. Very important with bones as well, because it does basically support vitamin D, keeps it in the system more active. So as a cofactor, it plays an important role. And that's, now I'll go into a few details as we move along. So we've covered that. Now, the absence of studies showing harm in conjunction with the number of articles showing benefits supports the consideration of boron supplementation of 3 milligrams a day for any individual who's consuming a diet lacking in fruits and vegetables, or who is at risk for osteopenia, osteoporosis, osteoarthritis, or breast, prostate and lung cancer. The reality is that you're not going to get these sort of dosages in standard food anyway. So, the people that basically do get to this sort of state is because they're basically very dysregulated in the first place. And so, like anything, these sort of supplementations do their magic at specific dosages for specific ailments when people are sick. And it's like anything. I mean, normal vitamin D, you'd get about 10 to 20,000 IUs from the sun. But if you've basically are severely deficient, you may require hundreds of thousands per day for a certain period of time to basically saturate your body and make those adjustments. And on the other hand, the body does recycle a number of these minerals and keeps them, in the system. So you don't need massive doses per day. So really, these sort of requirements become important when you've been on a standard sort of SAD diet or a deficient vegan diet or something like that, where you've got underlying issues to yourself in one way or another. You've got issues and you need to basically resolve them, and this was where Boron can help with some of these things. Different things for different people depending on what age bracket they're in, what their needs are, and so it will vary the dosages and the requirements. So to the first out of Iran, and they're basically looking at a daily and weekly boron supplementation for the steroid hormones and the pro-inflammatory cytokines. So basically, boron possesses this is their general introduction, widespread properties that is important for human and animal nutrition. Since boron is rapidly bioavailable, the objective of the present study was to determine whether acute, hourly, or daily or weekly supplementation could have any significant biological effects on the synthesis of steroids as well as inflammatory biomarkers. So their focus was on both inflammation and at the same time important factors in terms of hormones and all that. So that was their focus. So they use the word for their abstract as introduction in this sort of approach, and they pretty much outline the entire study within their abstraction, which is good. It makes it easier. We don't have to go through a horrendous amount of points, so to speak. And I'm trying to keep it as less sciencey as possible. Methods. 8 male volunteers participated in experimentation on 3 occasions, 0, 1 Ds. On the first day, 0 and blood samples were collected. So just their procedure following ingestion of placebo. So they gave them a placebo. On the next day of supplementation, similar procedure was followed by an ingestion of 10 milligrams. So as you can see, point up here. That they're basically following a sort of a randomized sort of double-blind placebo type approach. It's further down, but I can't remember where exactly it was. And on the next day after that, on both occasions, samples of blood were collected every 2 hours for the next 6 hours. So it's quite an intensive, clinical sort of study where they're in a clinical setting, a bit like, Volek and Finney usually do their studies, in a clinical setting every couple of hours, and they basically just take samples, and and so subjects consumed a capsule of 10 milligrams boron every day. On 7-day blood collection was carried out 8 a.m, so similar time. So there was no, confounding about the time of the day. So independent sample tests were all used to evaluate the differences. So they did have a control there, which is good. So they actually not only had these people, but also they had an independent control in the mix, which was good. Now, results. Plasma boron was significantly increased following hourly and weekly consumption of boron, which is good. After 1 week of supplementation, free testosterone levels were significantly increased, and estradiol concentrations were significantly decreased. So, that's pretty good for males, to see that sort of response of lowering estradiol and basically seeing an increase in free testosterone, which is really good for people and all that. So DHA, cortisol, and vitamin D showed slightly non-significant increases, which is good because it doesn't actually increase D levels or DHT, which is good, or cortisol. All it does is basically just, regulate them better. So it has a better regulatory approach on that. But on free testosterone, it bumps it up, which is what we really need. So the ratios of free testosterone to testosterone is that figure there, p-value, then free testosterone estradiol, sort of because of a reduction, so that different value, and then basically, the ratio difference between testosterone and estradiol, that's even a better number, which shows that it is definitely, we're getting good p-values in terms of testosterone being slightly elevated in comparison to estradiol, which was reduced. So were significantly increased. Also, all 3 inflammatory biomarkers were decreased after supplementation, which is good because we've also seen the 3 important inflammatory biomarkers go down, which is an important thing. So conclusions. All through, there were report a decrease in pro-inflammatory cytokines induced by boron consumption. To our knowledge, this is the first human study reporting an increase in plasma-free testosterone concentrations following consumptions of boron supplementation. This indicates possible protective role against diseases of pathological conditions for this microelement. So pretty much what they are saying is that we're pretty much seeing an improvement in this regard. So that's important that this is actually happening. So next, the upregulation impact of boron on vitamin D. So this is where not only the previous study, which was a human trial, which is very important. Remember, this is a human trial out of Iran, a clinical human trial with a control. So we can quite clearly say that, and they were taking blood tests every couple of hours. So we can be quite confident here that it's actually doing some magic in that regard. Now, the next one is upregulatory impact of boron on vitamin D. So does it reflect inhibition of 24-hydroxylase? Let's take a look. This is a Yugoslav study. This is back in 2003. So yes, nutritional intake of boron has been shown to lessen the adverse consequences of vitamin D deficiency in rodents. So this is a rodent study, but it's still basically, we're talking about a mammalian. We're not looking at mammalian physiology in terms of dietary stuff, which I criticize, and rightfully so that I criticize, because this is about vitamin D. Okay, we've already seen from the previous study that was done in humans that vitamin D stays in the system quite well, and what this is doing is basically also demonstrating that it actually does blunt deficiency, which is good, which basically means that certain people that are under par being supplemented with a boron will actually get an improvement in vitamin D status. So that's an important point. A bit like, for instance, the other one that I did about riboflavin, how it basically bumps up, if you've got the MTHFR issue, bumps up basically the improvement of the functioning of the enzyme that is involved in that other pathway. So for those people who have got that genetic SNP issue. So this again is actually working on potentially those sort of enzymes that are involved in that. So I'll just go through the study, the summary. Pilot clinical studies suggest that this effect may be mediated in part, in whole or in part, by the increase in serum 25-hydroxyl vitamin D. So that's the non-active form. We propose that in concentrations achieved this with good diet, boron suppresses the activity of the microsomal enzyme 24-hydroxylase, which breaks it down, chiefly responsible for catabolism of this steroid. This enzyme also has an effect on a number of other steroids as well. So it's not only, they are already looking at vitamin D, but consider other things as well in that connotation. So, but the focus is here on this. So boron is basically, and this may be another avenue where the other studies saw, free testosterone going up, estradiol going down in these males, and improving their hormonal sort of situation, and potentially having an effect on via influencing both this and possibly other pathways, enzymatic pathways as well, that we're not so certain about yet. So we're still learning about a lot of things, but this study focused on this pathway. So this inhibition may reflect a direct interaction with the enzyme, or perhaps boron's ability to form a covalent complex with the product of its activity. So what they're actually saying here is that it's either a direct effect on the enzyme, so in some way it's affecting the enzyme, the way it's actually, so that's the 24-hydroxylase enzyme, so it's probably inhibiting it, or in some way changing the way it actually behaves, so it is not as catabolic towards steroid hormones, which is what vitamin D is. So it's looking at that sort of angle, but then again it says, well, it could be playing some other like a cofactor or some other way modifying or changing its behavior. A bit like vitamin D can attach itself to macrophage and regulate it differently. So they're not certain exactly the mechanism. That's what they're actually saying. They can see the effect. So they can see, if you've got this, you increase boron, you will get this effect. But exactly the mechanism, how it happens, they're not so certain about it. So that's an important point. We're still learning in that regard. You can see and you can observe a phenomenon, but not understand why it's happening, is basically what they're saying here. So, an upregulatory impact of boron on 25 hydroxyl vitamin D, which is the non-active form, is potentially beneficial in the light of the fact that vitamin D status of many individuals is poor during winter months. So it could be a good strategy to basically try and keep your vitamin D levels from being degraded by that enzyme by inhibiting it, and so maintaining better vitamin D status even through winter is what they're talking about potentially. But we don't understand the mechanism, but this is what they're seeing in these rodents. Anyway, is potentially beneficial in the let me go further down. So, and traditional supplementation doses of this vitamin are often too low to correct this problem. Yeah, we bloody know. There is a growing evidence that good vitamin D status, as reflected by 25 HVD, may reduce risk for the host of prominent disorders. Thus, boron may have the ability to potentiate this protection, so enhance this protection. Clinical studies also suggest that the nutritional boron can upregulate 17B estradiol levels in women, including postmenopausal women receiving hormone replacement therapy. The catabolism of this hormone is achieved by microsome enzymes catalyzing vicinal hydroxylation, a description that has been also applied in 24-hydroxylase. So a similar way where it creates this degradation, especially in women postmenopausal, which it does affect their bones and stuff like that. So it seems that it has a positive effect there as well, for women to normalize their hormones much better in that postmenopausal state, so they maintain better hormonal balance going forward into old age, and being protective in a sense for their bone health as well. This suggests a more general hypothesis that nutritional boron can inhibit a range of microsomal enzymes which insert hydroxyl groups, vincicle and existing hydroxylase in steroids, basically to break them down. So, including the enzymes which catabolize estradiol and vitamin D. So basically, the 25 vitamin D type is basically degraded, and boron is quite protective against this degradation. So we can see here that supporting male hormonal state and preventing this degradation, is protecting vitamin D from being degraded, and so maintaining a better status, especially in winter. So it's probably a good status as an adjunct through winter. And on the other hand, also for postmenopausal women, to maintain their estrogen levels to good levels. So we'll move on to the next one. So this is basically a British study. We'll just go through this. This is back in '94, and this is one that I came across a number of years ago, which sort of got me onto boron in the first place. So this is an old favourite of mine. Anyway, I'll just go. Since 1963, evidence has accumulated that suggests that boron is safe and effective treatment for some forms of arthritis. The initial evidence was that boron supplementation alleviates arthritic pain and discomfort of the author. This was followed by findings from numerous other observational, epidemiological, and control animal and human experiments. These findings include A. Analytical evidence that lower boron concentrations in femur, heads, bones, and synovial fluids from people with arthritis and from those without this disorder. Observation evidence that bones patients using boron supplementation are much harder to cut than those of patients not using supplementation. So you can actually see density in bones. So surgeons that actually cut find that those with boron actually are much stronger, because it's involved in basically the K2 and calcium type metabolism with vitamin D. So it's involved in that part as well. So it's probably got cardiovascular protection as well. I haven't found good, because there's not any clinical studies in this area. So there's an observational, but doesn't tell me much. I need clinical, and unfortunately we don't have. But I suspect because it's involved in vitamin D and calcium metabolism, it must have some positive effect in that way. We just haven't found it because we haven't done the research, unfortunately. Anyway, epidemiological evidence that in areas of the world where boron intake usually was 1 milligram or less, the estimated incidence of arthritis ranged from 20 to 70%. Where in areas of the world where boron intake was usually 3 to 10 milligrams, the estimated incidence of arthritis ranges from 0 to 10. So basically, if you're consuming you've got a low intake of boron, in older age in particular, you will find people living in areas where the soils are depleted or the foods that they're eating are very poor in boron, will tend to have higher levels of arthritis issues, where those people in other areas won't. So that's a very important. These are epidemiological observational studies, but they're only looking at one factor. So there's no confounding factor. They're not looking at the diet. They're not looking at any other factors beyond the intake of boron or not. So these are people that are basically eating mixed macros, standard diets in these different parts of the world. There are not much difference in nowadays between a lot of people. Even in the 90s, large parts of the world were, they didn't have the same level of influence of the US food system yet. These were the early days. Even McDonald's was still using, basically up until that period, was still using, animal fats. So this was before, pretty much through the middle of the 90s onwards, where really we just basically fucked the entire health system and the nutritional system of the world after that. But prior to that, which is a lot of these studies, were still basically, a lot of these studies were done in the 70s and 80s and periods like that. A period when the food guidelines hadn't really affected, where the majority of a lot of the seed oils and refined sugars and all that was still concentrated in the more developed countries, like the US, Canada, Australia and all that. But even in those countries, it was still early days, So we're talking about many countries around the world they did observational studies, like in India, China, many other parts of the world, where they noticed these differences, where people were just doing traditional diets, but the people that basically, had more boron in their system, had better bone density, had less arthritis, had less issues. So, and when you're only looking at one factor, not multiple factors, you can pretty much say that it is, strong statistical strength and low confounding variables. So, because you're only looking at one factor. So it's like epidemiological looking at basically a virus or, a pathogen or whatever. You're only looking at one component. Tobacco, you're only looking at one component. You're not looking at multiple components. That's really important that we understand this. And, when they're talking about a range of 20 to 70%, we're not talking about odds ratio here. We're talking about these are absolute levels. Very different than basically, these are sort of the levels you would find with epidemiology of viruses, epidemiology of, plagues, like bubonic plague or something like that, looking at something like that, or epidemiology looking at basically tuberculosis or whatever else. These, you have strong statistical strength in the results of these studies, because it's either a 1 or a 0. There is no middle ground with these. There are no confounding things. You either have a certain level of boron in your system or you don't. We're looking at one factor, so there is no possibility of confounding, especially the old studies where they didn't have those. I'm not going to go through all of them because there's too numerous. That's not the focus of this. It's just to point this out. Experimental evidence that rats with induced arthritis benefit from oral intrapetinal administered boron. So experimental evidence with double-blind placebo boron supplementation with a trial of 20 subjects with osteoarthritis significantly favoured response to a 6 milligram boron a day supplementation was obtained. 50% of the subjects received supplementation improved compared to only 10% receiving the placebo. So placebo effect. So even the placebo effect, which is a significant effect, only had a 10%. Where there was a, pretty much half the people on the supplement were doing quite well. So it depends on it, because remember the range for areas around the world we were talking about earlier, the intake between 3 and 10 milligrams, and you were getting from 20 to 70%. So it is dose dependent, which actually fulfills the Bradford Hill criteria. The higher the dose, the better the response. That is, that's gold plated in that regard in terms of epidemiological to establish inference. So that's all we can do with epidemiological studies. We can only infer, but we've got a strong inference here of a strong statistical response that as you increase the amount, you decrease the pathology, which is important. And so I would say if you're getting, for some people, you're getting 6%. If people have far more advanced and developed, bone issues and health issues of that sort, then they may need to look at higher supplementation around, 10 or 12 milligrams per day. So it would depend in that regard. Preceding data has indicated that boron is an essential nutrient for healthy bones and joints, and that further research into the area use of boron for treatment and prevention of arthritis is warranted. Obviously, this is 94, based on all these other early epidemiological studies. And I mean, we've looked at more clinical type studies. And so they were basically saying, well, we've got some clinical studies, but we need more, but that's normal. Researchers always put that in. Give us more money. We'll get further down the rabbit hole. That's what they're basically saying. But, that's just standard mantra, as we knew. So, next one. So, this is one from North Dakota. And this is also back in 94. Nowadays we don't really do research on these sort of things, which is really unfortunate, but it's just a reality. The world is a very different place. yeah, the focus is on pharmaceuticals, rather than actually looking at fixing up deficiencies and stuff like that. Anyway, boron and brain function and cognitive performance. So this is another important thing, which I've sort of mentioned on occasion, the importance of boron in this regard as well. Element boron has for humans. Recent data studies suggest that boron may be important for mineral function. And remember, I did mention earlier about its role with, one mineral, which is calcium. But they have noticed that it does interact with a whole lot of other minerals, and within the membrane function well of cells. Brain function, you don't need as much as with bone, so it seems there is a different requirement in that regard from what I've noticed with studies. So to investigate further the function of role of boron, brain electrophysiology and cognitive performance were assessed in response to dietary manipulation of boron. So basically we had a low dose of 0.25 versus a higher dose of 3.25 milligrams boron in somebody with a standard 2,000 calorie diet, which is basically somebody around 70 kilos, which is that sort of standard figure that they sort of do, in 3 studies with healthy older men and women, which is good because they've looked at both men and women, which is important. Within their subject design, they used to assess functional response in all studies. Spectral analysis of electroencephalographic data showing effects of dietary boron in 2 of the 3 studies. When the low boron the high intake, there was significant increase in the proportion of low frequency activity and a decrease in the proportion of high frequency activity, an important often observed in response to general malnutrition and heavy metal toxicity. So performance, e.g. response time of various cognitive cognitive and psychomotor tasks that showed an effect of dietary boron. We contrasted with the high boron intake and low dietary boron results in significantly poorer performance on tasks emphasizing manual dexterity. So studies 1 and 3 looked at that. Eye-hand coordination, which was looked in study 2. Attention, all studies, so they looked at that. Perception, study 3. Encoding and short-term memory, all studies, and long-term memory was only in study 1. So collectively, the data of these 3 studies indicates that boron may play a role in brain function, cognitive performance, and provide additional evidence that boron is an essential nutrient for humans. So that's their sort of view, that it is essential. The sort of take-home message you can say is that if you're getting 3 milligrams of boron or more, you're probably going to be, maintaining good cognitive function. It doesn't seem like anything higher than that is giving anybody any, massive differences. It seems to, the high doses seem to work for other sort of ailments rather than the cognitive side. So, 3 grams is, what the standard pill tablets are nowadays. So it's easy to do in that regard. So it shouldn't be a problem for most people. Or just eat certain foods that basically have high boron or combination. Okay. Now, this one was in Houston, Texas. also in 94. This period was a period when there was a lot of research on boron back then, which was good, because nowadays a lot of, mineral research and stuff like that is neglected. Nobody does it. It's not sexy. And it's sort of forgotten. A lot of knowledge about boron has been forgotten. You ask most doctors nowadays or some researchers and they look at you funny, what? Boron? What's that? So most people have no idea nowadays, unfortunately. So plasma boron and the effects of boron supplementation in males. Sorry, ladies. Recent proliferation of athletic supplements has been marketed touting boron as an ergogenic aid capable of increasing testosterone. The effects of boron supplementation was investigated in male bodybuilders. 10 male bodybuilders aged from 20 to 26 were given 2.5 milligram boron supplementation, while 9 male bodybuilders aged 21 to 27, which is similar, were given a placebo for 7 weeks. Okay, plasma totals of free testosterone, plasma boron, and lean body mass and strength measurements were determined on day 1 and day 49 of the study. So, microwave digestion procedure followed by inductively coupled argon plasma spectroscopy was used for boron determination. So that's the technique they use to basically determine the concentrations when they actually measure the stuff. Anyway, that's technical stuff. 12 subjects had boron values at or above the detection limit, with median value of 25 nanograms per milliliter and 60 nanograms per milliliter lower quintile and 33 in the upper quintile. Of the 10 subjects receiving boron supplementation, 6 had an increase in their plasma boron. Analysis of variance indicates no significant effects of the boron on any of the other dependent variables. Then, both groups demonstrate significant increases in total testosterone, lean body mass, and 1 repetition maximum squat and 1 bench press. The findings suggest that 7 weeks of bodybuilding can increase total testosterone, lean body mass, and strengthen the lesser trained bodybuilder. But boron supplementation affects these variables not at all. So basically they're saying, well, it doesn't seem to have a big effect on these people. But the reason why I brought this up, I showed you this study, is because the level was 2.5 milligrams. So it's too low. That's why they didn't see this significant effect. From the other studies, you're looking at basically 3 for the mental side, or slightly over 3, and 6 or more for other effects. So at these lower levels, it's just statistical noise in terms of the general effect of the, because these people are basically, pumping iron and stuff like that. But generally, these activities will push up testosterone anyway. So at these low levels, they're not getting the effect. So obviously, when it comes to boron, it will have a more pronounced effect in people in older age. Because basically, as I've pointed out in numerous cases, a lot of these catabolizing enzymes, like CD38, in terms of, reducing your NAD plus and reducing your energy capacity, all these things tend to increase with age. And so certain things will inhibit these, and that's where you're getting more of the effect. So for younger people, yes, it's really hard to determine, because I haven't been able to find anything where younger people are doing high doses, and where it was done proper clinical studies to really work out, what's really happening. So, but from what I can see is, younger people probably has less of an effect, unless they've done a vegan diet or a really severe, sad diet, and they're quite depleted and quite damaged in a number of ways. It probably has more of an effect on those people. So it depends on the state of affairs. But generally speaking, as you're getting older, that is when a lot of this degradation takes place. It pretty much is because we run lower in energy levels, our mitochondria start suffering, and it's really mitochondrial dysfunction at the heart of it. And that mitochondrial dysfunction, as a consequence, starts, having this negative effect on other systems in our body. So CD38 suppressors inhibitors can play a role there, and boron can play a role in sort of slowing down this degradation that is happening to us as we're getting older. So that's really the take-home message. It's probably for younger people less important, but as we move in the later years of 40 and onwards, it sort of becomes more important that we look at certain strategic supplementation to support certain pathways and try and keep us going a bit, keep us in the more youthful range for a bit longer. It's another biohack in a sense for us oldies. That's where boron in higher levels than what you would naturally get from foods seem to play a bit of a role, a helpful role for us oldies to just keep us going, so to speak. Now, depending on what you're doing in terms of protocols and stuff like that, they will sort of vary based on what is needed to deal with at any particular time. So looking at basically at boron, we sort of have to consider sort of for different approaches. So if it's something to do with, cognitive sort of decline or stuff like that, I would say, probably around 3 milligrams in supplementation. You'll get a bit from food, which will pop it up into that level, is probably all that's required. You may need to sort of do an initial sort of higher dose for a period and then just come down to a maintenance level of 3 milligrams. So that would look like something like doing a week 12, then popping down to 9, then popping down to 6, and the 4th week going down to 3, and then just staying at that 3 level for that purpose. If you're looking at things like vitamin D, probably through the winter, maintaining better status by taking 3 milligrams every day. When it comes to other things where we're talking about more severe ailments and all that, you may want to go for a month on 12, then come down to another month on 9, then another month on 6, and then get down to 3 or 6, or stay at 6 depending on what you're dealing with. If you've got severe arthritis or severe menopausal sort of issues which you're dealing with and transitioning, you may need to take it for a longer period of time until things settle down and your hormones sort of adjust themselves. So it's a bit of playing with it, but I wouldn't go higher than 12, and definitely not nowhere near the sort of the really high levels of 20 milligrams. Definitely not to those levels. Please don't do something stupid like that, because we just don't have the science. It may not be as bad, but at the same time, well, we don't know. So let's not take risks, undue risks in that regard. Now, there is another issue in terms of thyroid. Now, this sort of research is, let's say, dubious, and they're looking at very high doses as well, but they're actually saying that it potentially could have an effect on thyroid in terms of affecting iodine. Now, if it does have a problem like that, you could just up your iodine a bit to the, rather than being at the 100 milligrams, go closer to the 200. So, because the band is 100 to 200, the recommendation of the RDA is 150, but you can go closer to the 200 if you need, for whatever reason, to do a higher intake of 12 or 9 or 6 for a longer period of time. Now, it is epidemiological research, so is it other confounding reasons? Just because somebody may have in the Middle East a higher level of boron due to consuming a lot of dried fruit, because dried fruit has a lot of high boron levels. Not fresh fruit, but dried fruit, and dried fruit is quite popular in the Middle East. So if you're consuming that, but you're also on a modern diet, plus with a whole lot of sodas, because you're Muslim, you don't drink alcohol, so you basically guzzle down the soft drinks like they do in the Middle East, and there's high levels of issues like diabetes and stuff like that. So is it other confounding variables and not the boron? So I think boron is just basically being targeted due to association, no different than LDL. But since we don't have any clinical studies in regards to long-term, multiple years of intake of high levels of boron and iodine metabolism and issues relating to that, it's always better to play it safe rather than reckless, in my book. Now, I don't think there is a real issue there, but I thought that to be honest, I need to bring up even these sort of dodgy epidemiological sort of nonsense, junk science, but just to keep that in your back mind and say, maybe I need to have a bit more iodine, a bit of more seafood, a few other things, just to basically cover myself if I'm doing higher doses for a prolonged period of time to deal with a number of ailments. So those are the sort of things, and my approach would be. The other nice thing about in terms of people with male pattern baldness, as you can see, I don't suffer those sort of issues, as you know, and at the same time, even though I have genetics for baldness and genetics for greyness and all sorts of other friggin' ailments, that's another story, as you know. Boron doesn't cause me any issues in that regard, or any other people that I know that are taking it, or I've suggested it to. So, but there is that research out there. Just up slightly your iodine, and that pretty much will cover it. I think it's a non-issue, but then again, you never can be certain with a lot of things, and normally people, the highest dose they'd be on a constant base would be around the 3 to 4 milligrams. It wouldn't be higher than that in normal diet. That's what the levels would be normally. So, the difference is that, most of our diets today are deficient. So we would have, in a normal diet, you would get these doses throughout your whole life, and you would have good levels of mineralization in your tissue, and it would be less of an issue. So what we're addressing here with higher doses is basically that our tissue doesn't have boron in the amounts that it should, that naturally it would have if we were eating appropriate diets in nature and we weren't, guzzling down refined oils and refined sugars like a lot of us have done for many years, because we believed the so-called experts on this point. So in that regard, we're dealing with deficiencies, underlying deficiencies. This is why we have very high levels of arthritis and all sorts of other ailments in the world. And and also it helps with areas like sugar metabolism and stuff like that. So a lot of us that have come from the SAD diet, and still some of us may have certain levels of insulin resistance or messed up hormones or stuff like that. Boron seems to play a really good role in adjusting those things. As you can see, even with while it can boost testosterone and improve estrogen sort of homeostasis within women, vitamin D isn't boosted in any way, it's maintained. So it has a regulatory effect in creating better balance, rather than actually causing any strange distortions. So I think it's pretty safe in that regard in terms of hormones. And there is quite good evidence. There was another study that I didn't bring here, but there is also evidence in terms of fertility that it directly has an effect on the testes. So if somebody wants that study for whatever reason, I'll give them a link. So it does have a direct effect on testes, and the improvements in terms of fertility and sperm quality and stuff like that. So we've seen that as well. So in that regard, boron is a good nutrient. So if you're suffering with fertility issues, consider boron as well. It's not considered an essential mineral, but I think it should be. Where exactly the dose is over a lifetime is hard to say, for the simple reason that we don't have good clinical studies to tell us exactly where those levels should be for a lifetime to basically maintain good levels of intake over a lifetime. The only things we can do is, when the majority of us are to some degree deficient, is basically take some remedial action to correct that deficiency. And that's what this video is about, to provide that information to assist you guys with sorting out those sort of underlying deficiencies and correcting them. Anyway, that's about it. I hope you enjoyed this video and you got something out of it. Anyway, see yous.